Is acne just a teenage problem? Absolutely not. Let's debunk this common myth right off the bat. Acne, a skin condition characterized by blemishes, is not solely a teenage issue. It can affect anyone at any age and in a variety of places on the body. From your face to your neck, chest, shoulders, and back, acne doesn't discriminate. So what is acne exactly? It's a skin disease that occurs when sebaceous glands under the skin produce an excess of an oily substance called sebum. This overproduction, coupled with dead skin cells, can lead to clogged pores, resulting in those pesky skin blemishes we know all too well. And here's a fact that might surprise you. Acne is one of the most prevalent skin conditions worldwide, affecting millions of people. So if you're dealing with acne, remember you're not alone. Now that we've busted the age-old myth, let's delve deeper into the world of acne. Ever wondered why and how acne occurs? It's all about the sebum and dead skin cells. Our bodies are like finely tuned machines, with various components working together to keep us functioning. Among these components are the sebaceous glands, tiny factories just below the skin, responsible for producing an oily substance called sebum. This sebum is like a moisturizer, coating our skin and hair to prevent them from drying out. It travels up the hair follicles and out through our pores onto the surface of our skin. Now, our hair follicles are constantly shedding dead skin cells, which get carried out of the body by the sebum. But sometimes, things don't go as smoothly as they should. When your body produces extra sebum and dead skin cells, they can stick together and clog your pores. This clog forms the basis for skin blemishes, or what we commonly know as acne. But the plot thickens. Bacteria, which normally exist in small amounts on your skin, can flourish in the sebum in the clogged pore. This can lead to inflammation, further exacerbating the acne problem. Depending on where the clog is located and if there's inflammation, acne can appear in various forms. It could be whiteheads, which are clogged follicles closed off from the air, or blackheads, which are clogged follicles that turn a darker color when the clog is exposed to air. Sometimes it could be pustules, commonly called pimples, which are inflamed follicles clogged with pus. In severe cases, it could be cysts, which are larger, painful, pus-filled lumps going deep under the skin. Hormonal changes, particularly a rise in testosterone, can lead to sebum overproduction. This is why acne often occurs during the teen years, but it can occur at any age and is influenced by other factors such as bacteria, certain medications, and genetics. Understanding the mechanism of acne is the first step towards effective treatment. So the next time you look in the mirror and see a blemish, remember, it's not your fault. It's just your body's way of telling you that something's out of balance. And there are ways to restore that balance, which we'll explore in the next scenes. Not all acne is created equal. There are different types with unique characteristics. Now let's dive into the wonderful, albeit frustrating, world of acne varieties. First off, we have whiteheads. These are the small, round blemishes that have a white center. They're caused by hair follicles being blocked by a mixture of sebum and dead skin cells. The reason they appear white is because the clog is not exposed to air, so it doesn't oxidize. Next up are blackheads. Unlike whiteheads, blackheads are open at the surface of the skin, which causes the trapped sebum and dead skin cells to oxidize and turn a darker color. Hence the name, blackheads. They're not dirty and you can't wash them away. They're simply a result of your skin doing its job, just a bit too well. Moving on to pustules, or what most people commonly refer to as pimples. These are inflamed follicles filled with pus. They're usually red at the base with a yellowish or white head. Pustules can be tender to the touch and are often tempting to pop. But remember, popping them can lead to scarring, so it's best to resist the urge. Lastly, we have cysts. These are the big guys. Cysts are large, painful, pus-filled lumps that exist deep under the skin. They're caused by severe infections in the pore and can result in scarring. These are the type of acne that you definitely want to have treated by a dermatologist. So, why is it important to understand these different types of acne? Well, because each type of acne is a result of a unique combination of factors, including excess sebum production, bacterial growth, inflammation, and pore blockage. And understanding these factors can help in designing an effective treatment plan. To recap, we have 4 main types of acne: whiteheads, blackheads, pustules, and cysts. Each has its own unique characteristics and causes, and each requires a specific treatment approach. It's not a one-size-fits-all situation. Each type of acne requires a specific treatment approach. Let's explore these next. When acne strikes, over-the-counter treatments can be your first line of defense. Now let's talk about some of these readily available options. They come in various forms such as lotions, gels, and creams, each packed with different active ingredients. Let's break down some of the most common ones. First up, we have benzoyl peroxide. This is a triple action warrior. It kills bacteria, dries up excess oil, and helps remove dead skin cells that are clogging your pores. It's like a mini cleanup crew for your skin. Next, we have salicylic acid. Think of it as a traffic controller for your skin cells. It slows down the loss of skin cells to prevent your pores from getting clogged. It can also work its magic to break down existing whiteheads and blackheads, helping your skin regain its natural smoothness. Then there are alpha hydroxy acids, such as lactic acid. These help in removing dead skin cells, reducing inflammation, and stimulating the growth of new, smoother skin. It's like giving your skin a fresh new start. Last but not least, we have sulfur. Now, sulfur may not have the most appealing smell, but it's a powerhouse at removing dead skin cells and drying up excess oil. It's a classic ingredient that has stood the test of time in skincare. These over-the-counter treatments contain strong chemicals, and while they're designed to help your skin, they can also cause irritation if not used properly. It's like using a power tool. If you don't follow the instructions, you might end up doing more harm than good. So, always follow the usage instructions. Start with a small amount, and if your skin tolerates it well, gradually increase. If you experience severe irritation or any adverse reactions, stop using the product and consult a dermatologist. Remember, over-the-counter treatments are just one part of the acne-fighting toolkit. They can be effective for mild acne, but for more persistent cases, you might need to explore prescription treatments or professional skincare advice. It's all about finding what works best for your skin. Remember, these treatments can be potent, so always follow the usage instructions. When over-the-counter treatments don't cut it, prescription treatments step in. It's important to understand that acne severity varies from one person to another, and for some, the battle against acne requires a more potent arsenal. Prescription treatments are specifically designed to tackle stubborn acne cases, and they come in a variety of forms. Let's explore some of these treatments. First off, there's vitamin A. Yeah, the same vitamin you'd find in your carrots and sweet potatoes. But in prescription form, it's a tad more potent. It works by reducing the buildup of dead skin cells in your pores, preventing clogs that can lead to blemishes. Next up are topical antibiotics. These are designed to wage war against the bacteria on your skin that can exacerbate acne. They're often used in combination with benzoyl peroxide to provide a 1-2 punch against acne-causing bacteria. For more severe cases, there's isotretinoin. This is the heavy hitter of acne treatments. It's used for the most severe cases and can lead to dramatic improvements. However, it's not a decision to be taken lightly, as it can have serious side effects. Corticosteroid injections may also be used to help clear up particularly large lesions. They can relieve pain and reduce inflammation, making them a valuable tool in the fight against severe acne. For women, birth control pills containing estrogen may be prescribed. These can help to minimize the effects of testosterone, a hormone that can lead to overproduction of sebum and, consequently, acne. But let's not forget, no acne treatment is a magic bullet. While these treatments can be effective, they're not a replacement for good skincare habits. Washing problem areas twice daily with a mild soap, using an oil-free moisturizer if your skin is dry or peeling, and avoiding the temptation to pick or squeeze blemishes are all key. Remember, these are potent treatments and should be used under the guidance of a dermatologist. No matter the treatment, good skincare remains essential. After all, the best defense is a good offense, and maintaining healthy skin is the first line of defense against acne. No acne treatment is complete without proper skincare. It's not just about what you put on your skin, but also how you treat it day to day. Here are some essential tips to keep your skin in top shape. Firstly, gentle cleansing is key. Wash problem areas twice daily with a mild soap. Scrubbing too hard can actually worsen acne, so remember to be gentle with your skin. Moisturizing is just as important, especially if your skin is dry or peeling. Use an oil-free, water-based moisturizer to keep your skin hydrated without clogging your pores. Avoid the temptation to pick or squeeze blemishes. This can lead to infection or scarring, which is something we all want to avoid. Finally, when choosing any product to put on your skin, look for an oil-free or non-comedogenic label. These products won't clog your pores, helping to prevent further breakouts. Remember, understanding acne is the key to treating it effectively. So, keep learning, keep treating, and keep your skin healthy.
If you are enjoying our content, please give us a like and subscribe.